Welcome to MD Newsline. Thank you so much for taking the time to come and chat with us today. Can you please introduce yourself to our audience?
Sure. Thank you for having me. So I'm Jen Vermillion. I'm an assistant professor of neurology and pediatrics at the University of Rochester in Rochester, New York. And I specialize within that in pediatric movement disorders.
Yeah, so talk to me about the spread of pediatric movement disorders that you cover.
Yeah, people think it sounds very niche, and it is, but it actually covers a wide variety of issues. So I see kids all the way from newborn all the way to mid-20s, which isn't really kids anymore, but still keep seeing them. And it can be anything from funny movements that some kids will do where parents might be worried about it and it's benign, so not anything too concerning, all the way to pretty rare, devastating neurodegenerative disorders that often have movement disorders as a component.
So when you say movements that might be benign, what are some of those movements?
So, for example, so a lot of people, especially if they've had children, might kind of get this where babies will do lots of kind of funny things. So they might do like a funny kind of shudder thing that some kids will do that look scary. You don't know why your child's doing that. That's something called shuddering that a lot of infants will do that we don't generally worry about. They grow out of it. So a lot of those kinds of patients will come to me for an evaluation, and I can very, very well provide reassurance, which is nice to be able to do for a lot of families.
I have not grown out of shuddering. I'm shuddering more every year. Are there any trends that you've seen over the years in movement disorders that are benign, for instance?
I would say I haven't seen so many trends within the benign realm. And the benign, I'm thinking more as, a developmental sort of movement that isn't an actual disorder that they grow out of. There are other kinds of movement disorders where it might not be as devastating of a course as we sometimes think about in that more extreme area that I was talking about, but might be something where kids will still do well and they can achieve great things, but they might have some symptoms that just need some management. So in that realm, I would think about things like Tourette syndrome, which I was mentioning to you before is an area that I specialize in and I'm passionate about. So the tics can be problematic at times, these repetitive movements and sounds, but also a lot of kids will be fine with them and they might not be bothered by them. So in that way, they're benign in that way. And so for trends in that realm, I would say what I see a lot is that a lot of kids who have movement disorders of different kinds, they also have a lot of psychiatric symptoms that come along with it. And so I think that it just reinforces how important it is to take care of the whole person and not just the movement, because there's a lot that can often come along because it all lives in the brain. And so sometimes we try to parse it out, but it doesn't always parse out quite so cleanly.